Hello, this is Dr. Do again. This video is alphabetic list of problems on letter H. Today I'm going to talk about a hyper or hypokalemia, which means increase or decrease the potassium in the blood. Is there any situations associated with this conditions, hyper or hypokalemia, warrant emergency visit? Yes, both of hyper or hypo, if it is very severe, will impair the function of heart, will generate an arrhythmia or even a systole. So if that's the case, then I really need to see the emergency or call your physician. Usually, this condition occurred with those people who have kidney disease or who have endocrine disease. For the regular, so if you had this kind of conditions, your physician probably already alert you. If this is what are the signs, you need to call them or to visit the emergency room. Usually, if you have this kind of conditions, you'll feel your heartbeat unusual and feels shortness of breath or chest pain with or without this. But if you feel your heart thrills in the irregular or something new, then you need to call your physician or go to the emergency. That probably indicate the potassium level either high or low. It's not which could be like 13. So usually, can you manage at home for this hyper or hypokalemia? Usually not, unless you were checked by your physician, you have been healthy, only during this couple of days or a week you did not eat well, you have consistent diarrhea, and your physician checked to make sure it's not severely imbalanced and prescribe you with medications or electrolyte. So if that's the case, you can, but still need to supervise or contact with your physician after the diagnosis, and then you can probably, like I said, drink some electrolytes and to correct it. So talk about that. What are the common causes for this abnormality of potassium? Usually, like I said, either the kidney disease, either lost too much or couldn't get rid of it. If lost too much, then probably it's cause the hypokalemia, or if cannot excrete the potassium, then will cause the hyperkalemia. Or the endocrine disease, there's particularly a special hormone called aldosterone, which is help regulate the body through the kidney, excrete the potassium and reserve sodium. So if this aldosterone is not normal, can cause hyper or hypokalemia. The other scenario, like I said, if you had prolonged diarrhea or vomiting, you lose this eye through the digestive system. It also can cause this disturbance. Usually, if you have been healthy, then this disturbance should be short-lasting after replacement. There's another scenario occur in the patient who has the surgery in the digestive system. For example, there's opening in the small or large intestine, particularly small intestine, lose the fluid all the time. So that's also can have this abnormalities. But regardless, usually this hyper or hypokalemia occurred to those who are diagnosed with abnormalities or comorbidities. Your physician already probably told you what are the signs to look for to call the emergency or call your physician. Basically, if you feel your heartbeat really as not as Euro state, so then probably indicate something serious happening. So why the mechanism for this potassium is so critical is because the potassium contributed to the voltage maintenance across the cell membrane. All the cells, particularly the excitatory cells, which refer to the muscle cells or nerve cells, because those cells has the capacity to generate the signal and passing along to the adjacent signal, and then leading to the muscle contraction or the nerve signal passing along. So, for example, there's a resting potential which is maintained by the potassium continuously flux out, going out at the cells, and to maintain the normal voltage across cell membrane. So when the signal arrived, so those cells, for example, the potassium channel, the sodium channel closed, so the huge amount of sodium flux in the cells, causing this action potential, and this stroking peak of the potential generated the signal or trigger muscle contraction or nerve cells signal to passing along. So this is the fundamental mechanism why the potassium is so critical. The regulation of potassium, like I said, there's a hormone, particularly aldosterone, regulate the kidney absorb or excrete this potassium. Or so if this the chronic diseases, like I mentioned, either kidney or endocrine, but there's some people probably unknown, undiagnosed aldosterone, like the tumor can secrete extra aldosterone, then we'll have the hypokalemia, because this aldosterone keep telling the signal to the kidney excrete the potassium, so the body potassium is lower than supposed to be. So if that's the case, then what kind of symptoms for losing the potassium, hypokalemia? Really, I think it's the fatigue, because the muscle lost the strength, lost the signal to contract, to feel fatigue, and also tired, of course, and sometimes may or may not have cardiac symptoms. But if you suspect that you might have this kind of problem, you just feel tired all the time and do not know the cause, do not know the reason, could be many other causes like anemia or any other problem. But this potassium abnormality is also one of the cause. So if that's the case, then you need to talk to your physician and to do the exam. Usually that's not quite common in the healthy people. Again, this hyper or hypokalemia occurred with those either endocrine abnormality or the kidney diseases. So in terms of treatment, replace the potassium. I think the very critical point is replace smartly, not too fast, not too much, or if it's too much, if the potassium is high in the blood, then through dialysis or some binding medications to get rid of the extra potassium. So this is about the hyper or hypokalemia. Take-home message, I think, particularly for those who have kidney disease or endocrine disease, or diarrhea for lasting 1 or 2 weeks, or vomiting, cannot hold the food down. So if you develop feel very tired, you just need to see your physician. Sometimes need to replace it through the IV infusion. So that's the video for today, and just remind or for those who do not know, and hope it helps. Thank you for watching. I will see you next time.